Listen in to Lynne August MD explain how to determine if Flame Quell or MGS is best for pain for someone with acidic urine.
To determine whether to use Flame Quell, fatty alcohols, or MGS, bivalent negative sulfur, for acid pain, we must know whether the acidity is caused by excess fatty acids or excess anti-fatty acids. There is a dynamic oscillatory balance between fatty acids and anti-fatty acids. In a healthy metabolism, the oscillation is between the ongoing formation and cleavage of cholesterol fatty acid esters. Since urine pH corresponds to tissue pH, we are looking at this balance in tissues with the urine pH. Fatty acids acidify tissues and urine. Cholesterol alkalizes tissues by binding and neutralizing fatty acids. Actually, there's more than polar bonding between fatty acids and anti-fatty acids. There is steric coupling between the energetic centers of the fatty acid molecule and cholesterol. The well-known metabolites of arachidonic acid, the series 2 prostaglandins, thromboxane, prostacycline, and leukotrienes are made from these energetic centers. Here is a healthy diurnal urine pH. Cholesterol is highest at 4 a.m., yielding a greater than 6.2 urine pH. Conversely, free fatty acids peak at 8 or 9 p.m., yielding a urine pH less than 6.2. Let's turn to two cases. Both people have acid urines. First, we have a 72-year-old woman with degenerative arthritis. Her arthritis affects her joints and her spine. Of the 22 urines that she tested, she has 15 with a pH less than 6.2, and there's no diurnal variation in her urine pH. He, 66 years old, with prostate cancer, extensive bony metastases that are very painful. Of his urines, they're all acid. 2 are 5.8 and the rest are 5.5. And we will find that it is often the case that people with high tissue cholesterol will have the more acid urines than the people with low tissue cholesterol. And that holds true here. And also note that the high tissue cholesterol is accompanied by a low serum potassium, whereas a low tissue cholesterol is accompanied by a high serum potassium. So let's move on and look at tissue cholesterol in more depth. Tissue cholesterol can be calculated from the total HDL and LDL cholesterols in serum. The information on this slide can be found in the forum at drrivici.com. LDL delivers cholesterol to tissues. HDL lipoproteins remove it from tissues, so the ratio of LDL to HDL cholesterol times the total gives us tissue cholesterol. When cholesterol is high in tissues, it is high in cell membranes. When low in tissues, it is low in cell membranes. High cholesterol in cell membranes decreases permeability of the membranes, and potassium is more concentrated than usual inside cells. and vice versa for fatty acids. Fatty acids increase membrane permeability, so there is an intra and extracellular shift in potassium, reflected in higher serum potassium. The acid pain of the woman with degenerative arthritis is the result of excess fatty acids, evidenced by her high serum potassium and low TCH, tissue cholesterol. So she experiences great relief from Flame Quell. Flame Quell is fatty alcohols. Fatty alcohols form esters with fatty acids, and just like cholesterol, fatty alcohols neutralize and disable the fatty acids. On the other hand, the acid pain in the man with cancer metastases is the result of excess cholesterol in tissues, evidenced by the low serum potassium. His acid pain is not due to fatty acids, but rather to his high tissue cholesterol. MGS, bivalent negative sulfur, is highly alkalizing. High cholesterol in tissues acidifies tissues, and therefore urine, by inducing anaerobic metabolism. The anaerobic metabolism is only partially due to a shortage of oxygen. High cholesterol in cell membranes makes the membranes less permeable to the oxygen. Aerobic metabolism cannot be sustained because fatty acids bound to the high tissue cholesterol cannot undergo beta oxidation. Beta oxidation generates the oxidized NAD necessary for the conversion of glucose to pyruvate. When fatty acid oxidation in the electron transport chain diminishes, necessary oxidized NAD is instead generated by the conversion of pyruvate to lactic acid. So when you see a person with high cholesterol in the serum, the question to ask is there high cholesterol also in the tissue? In which case, likely, anaerobic metabolism is contributing to their pathology. Stay tuned. The next installment discusses pathological fatty acids. Talk to you then.